Okay? I need to tell you about the most confusing thing the United States Congress has done to seniors in decades. They gave you something with one hand, and they took something far bigger away with the other. And the way it was announced, the press releases, the headlines, the social media posts, were designed to make sure you only heard about the gift, not the taking. Here is what I mean. The One Big Beautiful Bill. You have heard of it. Signed into law, celebrated, praised. And somewhere in all that celebration, a very important number got completely buried. $1 trillion. That is how much the One Big Beautiful Bill cuts from Medicaid over the next 10 years. $1 trillion. According to the Congressional Budget Office and the nonpartisan agency that scores every single bill Congress passes, that is not a political opinion. That is the official number. And according to that same analysis, nearly 12 million Americans are projected to lose their health insurance because of this bill. Over the next decade, nearly 12 million people. Today, I'm going to break down exactly what this bill does for seniors, what it takes from seniors, and what the real math looks like when you put it all together. Because the full picture is something almost nobody has shown you, and you deserve to see it. Let me start with what the bill actually gave seniors. Because some of it is real and some of it matters. The most talked about benefit is the new $6,000 senior tax deduction. Starting this year, 2026, Americans who are 65 or older can claim an additional $6,000 on top of their regular standard deduction on their federal taxes. Now, who actually benefits from this? If you are a single filer age 65 or older with income under $75,000, you get the full $6,000 deduction. If you are married, filing jointly with combined income under $150,000, you get the full $6,000. For the average senior with Social Security income and a modest pension or IRA withdrawal, this deduction could reduce or even eliminate federal taxes on their Social Security benefits entirely. That is genuinely helpful. For people in that income range, the savings could be around $600 to $1,100 per year. The bill also made the 2017 tax cuts permanent, meaning the larger standard deduction that everyone has been using since 2018 does not expire at the end of 2025 as it was scheduled to. That is worth real money for most taxpayers. So yes, there are real benefits in this bill for seniors. I am not going to pretend otherwise. But here's where the bill gets complicated. And dark. Because at the same time this bill was cutting taxes, it was also cutting something that tens of millions of seniors depend on for their health, their daily care, and their survival. Medicaid. Now, I know some people hear Medicaid and think, that is for poor people. That is not for me. I have Medicare. And that is one of the biggest misconceptions I see. So let me set the record straight right now. Medicaid is not just for low-income working-age adults. Medicaid pays for nursing home care, home health aides, personal care attendants, assisted living support. The things that keep elderly Americans out of institutions and in their own homes. More than 13 million Americans are what is called dual eligible, meaning they qualify for both Medicare and Medicaid. These are typically older adults and people with disabilities who have very low incomes. Medicare covers their hospital and doctor bills. Medicaid covers the gaps, the co-pays, the long-term care, the in-home assistance. For these 13 million people, cutting Medicaid does not just affect their insurance card. It affects whether someone shows up to help them bathe, eat, and take their medication every day. And the One Big Beautiful Bill cuts Medicaid by $1 trillion over the next 10 years. That is the largest rollback of federal health care support in American history. The Congressional Budget Office confirmed it. The number is not disputed. Jeff Salter, the founder and CEO of Caring Senior Service, which provides home care to elderly Americans in 20 states, said it directly. He said, "We are very concerned that the Medicaid cuts are going to force states to scale back coverage. And when states cut Medicaid, the first things to go are optional benefits like home and community-based services, the in-home care, the daily assistance, the things that let seniors stay out of nursing homes. For a family counting on Medicaid to pay for a parent's home health aid, that is not optional. That is everything." Now here's the second number that almost nobody is talking about. $500 billion. That is the amount that Medicare, not Medicaid, Medicare faces in automatic cuts triggered by the One Big Beautiful Bill. Here's how it works. Federal budget rules require that when Congress passes legislation that increases the deficit, automatic spending cuts kick in to offset it. The One Big Beautiful Bill adds $3.4 trillion to the federal deficit over the next decade. That triggers automatic cuts across federal programs. Medicare is one of those programs. And the automatic Medicare cuts triggered by this bill are scheduled to begin in 2026. $500 billion in potential Medicare cuts over the next 8 years. Now, Congress can vote to waive these cuts. They have done it before, but it is not guaranteed. And every time Congress has to vote on whether to protect Medicare from automatic cuts, it creates uncertainty, last-minute drama, and the very real possibility that one year they simply do not act in time. Over 65 million Americans depend on Medicare. If those automatic cuts go into effect, the impacts could range from reduced payments to doctors and hospitals, which could cause providers to stop accepting Medicare patients, to changes in coverage and cost sharing for beneficiaries. The people most exposed? The 13 million dual-eligible seniors who are already getting hit by the Medicaid cuts. They face what one policy analysis called a double impact. Medicaid cuts reduce their daily living assistance. Medicare becomes more expensive and harder to access, both at the same time. Now let me talk about the work requirements, because this affects millions of people between 50 and 64 who are not yet on Medicare and depend on Medicaid for their health coverage. Starting in January of 2027, less than 19 months from today, Medicaid-eligible adults between the ages of 19 and 64 who receive coverage through the ACA Medicaid expansion must prove they are working, volunteering, going to school, or participating in job training for at least 80 hours per month. Every month, with paperwork. Now there are exemptions: people with disabilities, primary caregivers, pregnant women. But AARP's Public Policy Institute ran the numbers. They found that 9 million Medicaid recipients between the ages of 50 and 64 would face these work requirements. 9 million people between 50 and 64. Think about who that is. Someone who worked in a physical job their whole life, construction, farming, manufacturing, and their body gave out at 58. They are not disabled enough to qualify for disability benefits. They are not old enough for Medicare. They are on Medicaid. And now they have to prove every single month that they are working 80 hours. AARP's CEO called it a steep coverage cliff for people in their 50s and early 60s. People who are nearing retirement, people who may be working part-time because their health will not allow full-time work, people who could be left with no affordable coverage option at all. If they lose Medicaid at 58, they have potentially 9 years before Medicare kicks in at 67. 9 years with no health insurance. For people in that age group, that is not a minor inconvenience. That is a life-threatening gap. And there is one more cut in this bill that affects seniors that almost no one is covering: food assistance. In 2023, more than 11 million Americans age 50 and older received food aid through the Supplemental Nutrition Assistance Program. The One Big Beautiful Bill cuts federal funding for that program. For a senior on a fixed income who is already struggling with rising grocery prices, losing food assistance is not a policy change. It is skipping meals. So let me put the whole picture together, because this is the comparison nobody is making. What the One Big Beautiful Bill gave seniors: a $6,000 tax deduction worth about $600 to $1,100 per year for eligible filers, available through 2028. What the One Big Beautiful Bill took from seniors: $1 trillion in Medicaid cuts over 10 years, $500 billion in automatic Medicare cuts triggered by the deficit increase, beginning in 2026. Work requirements that could strip health coverage from 9 million Americans between 50 and 64. Cuts to food assistance used by over 11 million older Americans. The tax deduction helps seniors who have income to deduct from. The Medicaid cuts hit seniors who have the least. The people who benefit most from the $6,000 deduction are middle-income retirees with taxable Social Security income and investment accounts. The people who get hurt most by the Medicaid and Medicare cuts are low-income seniors who depend on those programs to survive. It is the same bill. Two very different experiences, depending entirely on where you fall in the income distribution. So what should you actually do with this information? Step 1. If you are 65 or older and your income is under $75,000 as a single filer or $150,000 as a married couple, make sure you claim the new $6,000 senior deduction when you file your 2026 taxes. Talk to a tax professional. This deduction is real and available right now through 2028. Step 2. If you or a family member receives Medicaid, whether for nursing home care, home health aid services, or anything else, pay attention to state-level announcements about Medicaid changes. States will be the ones implementing federal cuts. Watch for changes to eligibility, covered services, and provider networks in your state starting in 2026 and 2027. Step 3. If you are between 50 and 64 and on Medicaid through the ACA expansion, understand that work requirement paperwork begins in January of 2027. Start gathering documentation now. Do not wait until the deadline is days away to figure out what you need to prove. Step 4. Stay informed. The Medicare automatic cut situation will play out in Congress over the next year. If Congress does not act to waive the cuts, Medicare could face real reductions beginning as early as the end of 2026. Let me bring it all together. The One Big Beautiful Bill is not a simple win for seniors. It is not a simple loss either. It is complicated. And the way it was sold, with the $6,000 deduction front and center and the $1 trillion Medicaid cut buried in footnotes, was designed to make you feel good about something that has a very different backside. The $6,000 deduction helps for the people it reaches. But cutting $1 trillion from Medicaid, triggering $500 billion in automatic Medicare cuts, threatening health coverage for 9 million Americans between 50 and 64, cutting food assistance for 11 million seniors. Those are not footnotes. Those are the lives of real people. You deserve to hear the whole story. That is what this channel is here for. If this video gave you information you could not find anywhere else, hit the like button. Share it with someone who needs the full picture. Subscribe so you never miss when I drop the next update. Drop a comment below. Did you know about the Medicaid cuts when you heard about the $6,000 deduction? Tell me what you think. I will see you in the next one.